fight against COVID is on many fronts, and occasionally we take you to ICUs to see how health workers are helping patients survive this deadly virus. Today, I'm here at the West Africa Center for Cell Biology of Infectious Pathogens, and this is one of the centers, part of the front line trying to deal with this. And we don't hear often of what happens here, and that's why I'm here today to find out from the scientists who are sequencing to determine if new variants found across the world and even at our airports are in our communities. And you've heard the word, we've heard the president talk about this, but for many of us who may not understand how this process goes on, it appears it's delaying and creating some anxiety amongst us. So I'm here to find out from the scientists here what really it entails and how close we are to determining if these variants are in our community at all. And if you're a frequent watcher of News Desk, you know that one of my resource persons for COVID is Dr. Yao Bediako. Today, we are here in his office. Yes, it is his office. Doesn't look like a regular office, but he's hosting us, and we're going to learn a lot more about how sequencing happens. Thank you for hosting us, Doc. First off, tell us basically what sequencing is.
All right, nice to see you, Bernice, in person, not on Zoom. So sequencing is a technique that allows us to study the genome or the DNA of a particular organism. And so it's basically, if you think of DNA as a code and a code of letters, sequencing allows us to read this code and to decipher what the code means. So that, simply put, sequencing is basically just reading the genetic code of an organism. It can be a human being, it can be a virus, it can be a parasite. In this case, obviously, we're interested in the SARS-CoV-2 virus. So I can show you our sequencing facility, and our scientists there can explain how sequencing is done, at least so your viewers can see behind the veil, as it were. All right. So this is our sequencing lab. So I'll hand you over to Joyce, who's our manager, who manages our sequencing facility, and she will walk you through the process of sequencing, how we generate this data about the SARS-CoV-2 virus.
All right, thank you very much. Nice to meet you, Joyce.
Very nice to meet you too.
All right, and let me start off by saying thank you, because a lot of people don't realize that this is actually one of the fronts of the war, and we need to also win it on all sides. So basically, run us through what happens here with regards to sequencing.
Okay, so once we receive the sample, the raw sample from the patients, we usually do RNA extraction. The RNA extraction happens in another lab. Because of the infectious nature of the sample, we have to do it in a biosafety cabinet. So after we extract the RNA, we bring it here, and then we proceed to QC the RNA. So usually the QC happens on the other side, so we want to make sure that we are starting with a good quality material before we proceed for sequencing. Then after that, we convert it to cDNA. So after the cDNA conversion, then we come here and do PCR. So what we want to do is we want to increase the amount of the viral material in the sample. We come here, prepare our reagents for the PCR. This gentleman is doing.
Okay.
And then after that, we come here and add our sample to the PCR master mix that we prepared. Okay. So our sample addition takes place here. That's what this lady is doing. And then after that, we load it onto a PCR machine. Okay. So the PCR machine we have one over there. And then we run it for at least 3.5 hours. So that will help us to amplify the amount of the virus in the sample. So once we have the sample ready, then we proceed. This machine here is called a tape station. So this is just another way of making sure that we are preparing our sample well.
This appears to be a lot of work. How many samples are you able to run in a day?
So with the current personnel we have, we are able to sequence at least between 100 and 150 in a week.
And how many samples do you need, or just one sample can help you determine if we have a variant from a certain country within our community?
So Currently, because we just want to see how the virus is changing.
Okay.
We don't need like a very huge sample size. We need at least a good number of samples just to detect in those samples and see if we have the mutation in those isolates that we've gotten from the patient. So this is where the sequencing happens, and the sequencing happens in these miniature devices. They are small, but they are quite powerful. So these are called MinION.
How many samples are in each device?
Currently, we are running 24 in each device.
Okay, but what's the capacity?
You can do up to 96 per run.
Device.
In this flow cell, this is where we load our sequence. So you just open this. Once you have the flow cell loaded, we load our sample into this. Okay, so you just pick up an amount like that. We usually load like 75 microliters and just load it dropwise into this pot.
Okay.
So that's where we load our sample.
Okay.
So usually what happens during the sequencing process, we have in this orange yellowish area that you see, there's a membrane in it, and the sequencing usually happens in through what we call nanopores. So this technology is called nanopore sequencing. So they use nanopores that are small holes, like nanomolar in scale. So DNA is made of 4 chemical bases, which is A, T, C, G. So when we are sequencing, those molecules will pass through the pore. When each molecule passes through the pore, then the ionic current is disrupted, and then we can measure that disruption. So every molecule is going to disrupt the current differently. So that raw signal is going to now be converted into sequencing data, showing that how the 4 bases are arranged within the DNA that you're trying to sequence. Then after that, we get the data. So these are the files. When you look at it, you can't make sense out of it.
Okay.
But when you give it to the bioinformatician, then they will just, do the analysis and give it to us in a way that we can understand and see that there's a mutation in this part of the virus genome and all that.
Thank you for having us, Joyce. We're out of the sequencing room now, and just to get some simplification from Dr. Yaobedi, before we go to the analysis center where all the data is interpreted, tell us how many minutes or hours it would take for one sample run, and why this appears to be taking long, at least in the eyes of the public.
Yeah, so I think, I hope what you saw from Joyce's explanation was how technically complicated the process of sequencing is. It's not that you just take somebody's sample and stick it on a sequencing machine and you get it. For a single sample, you are looking at anywhere probably about a total of 8 to 12 hours of total, work time for a single sample. When you now talk about doing many samples together, that significantly increases the time. So you have about 5 days of just generating the data, and then you need to give the bioinformatician, the data analyst, time to then analyze the raw data to make sense of it.
Isn't there a simpler way of doing it?
The general process of sequencing is very similar for what Joyce has showed you. The final step of loading it on the sequencing machine may differ depending on what platform you're using. But in general, the steps are the same. If you want to do this quicker and on a larger scale, we need to expand our capacity. I'm happy to say that in addition to WACBIP, there is sequencing going on at Noguchi and at UHAS. But in many ways, their facilities are not much larger than ours. This is the level of capacity we have in Ghana. And I'd also comment that there is a certain significant cost also associated with sequencing. So the flow cells that you saw her load on, which are consumables, they are things you load, and then once you're done with the run, you discard. That on its own costs $1,000. And indeed, all the reagents, they may not look like a lot of volume. All the little reagents you have to add, the magnetic beads she talked about for pulling out the DNA. When you put all of that together, the cost of sequencing a single sample is anywhere from about $100 to $150. So the 100 samples that I said we can do a week equates to $10,000 of cost. So if you want to increase capacity or increase the speed with which you do things, that has to be followed with significant investment from the government or from the private sector.
We're spending thousands of dollars sequencing. Is it just to know if this variant exists in our communities? What's the significance of knowing this?
Mm-hmm. So, we like to use our resources carefully. So we're not just sequencing for the sake of sequencing. It's very important that we understand how this virus is changing over time in our population. The first thing is, as you have heard, through sequencing efforts like this variant in the UK was identified. Even though we call it the UK variant, that's just the first place it was identified. And that is because the UK has invested significant resources in sequencing. The UK alone has done 200,000 COVID SARS-CoV-2 sequences since the pandemic started. And by identifying that variant, they were able to pinpoint exactly why they had a surge. So we need to do the same if we are to understand why the virus behaves the way it does. Currently, we are seeing a surge. It may be because we have a variant that is highly transmissible. The next has to do with the vaccine. This virus is mutating, and over time it will continue to mutate. The vaccines have been developed based on one variant or one variant of the virus. Now, over time, as the virus mutates, there may be, unfortunately, a situation where the virus mutates away from what the vaccine can recognize. Because there are a few vaccines available. Each of those vaccines may target slightly different variants. And so it's important as a country for us to have a clear idea of what the variants circulating in Ghana look like, so that when the Ministry of Health goes to procure a vaccine, they have enough information to ensure whatever they procure is actually going to work for COVID in Ghana.
There's a lot to learn about this virus. Clearly, you can see the scientists themselves are doing a lot to understand how this virus works. Quickly, from here, we'll move to the analysis center, where Dr. Albediakwe again will be explaining to us how they interpret the information they gather from sequencing. We've got a presentation ready for you. So over to you, Doc.
Thank you, Bernice. So this is just to help explain the final step in sequencing, which is really the data analysis. And just to recap where we are, samples were collected across the country because we're interested in understanding, the evolution of the pathogen in Ghana, but also understanding where perhaps variants are coming from. What we try to do with sequencing is understand the DNA code that is within, in this case, the virus. Now, different viruses will have different genetic codes. Variants are basically different forms of a virus. And so the way we classify variants is basically based on their genetic code. And so sequencing gives us a string of letters. You can see these letters here. These are basically the letters that are associated with the DNA. And what we do to identify variants is to try to find small changes in the genetic code that would classify a virus as being part of one variant or another. So when you get data, so Joyce and co have generated a lot of data for the sequencing. This is basically what you get. This is the whole genome of the virus, and each of these tiny
Well, let's cross over now to the Ministry of Information, the press center to be specific. There's an update on COVID-19, and Director General of the Ghana Health Service, Dr. Patrick Kumabwaje, is speaking now. Let's connect with them.
Did not record any new positive cases for this period of our reporting. Total case of admission is so far, those on admission is about 294. Total case of admission is so far, those on admission is about 294. 34 of them are critical, 122 are severe, and the rest are mild. And that's an area we need to be more cautious of, and we would appeal that people should come in early so that we can catch more people in the mild to moderate stage before they move into severe and critical, which is very difficult to save their lives. So if you look at the table, we have them in the various hospitals across the country. That comes up to 294 cases, and the critical of 34. Majority of them are at the military and the Ghana East hospitals. KIA so far, total number cumulatively is about 1,136, as we've always been mentioning. And the total tests done is 152,000 plus, with a positivity rate of 0.74%, quite close to the cumulative positivity in the country, which is about 8.7. As we mentioned, we can see that in absolute terms, the number of cases reported at the airport continue to decline, maybe as a result of restrictions in travel and the fact that the PCR negative, we are tightening the control to ensure that they are really PCR results that they are bringing in. We have so far recorded 430. We recorded 430 in January, so that is where we are now. If you look at the previous month, we have 393 in December for the airport, but in January alone, we have 430. Let's hope that with the decline, February will give us fewer numbers into our active cases.
The schools outbreak, we still have limited outbreaks across the countries. We've had some cases in Upper West, Western, and Greater Accra. Greater Accra, as I mentioned earlier, has cumulatively reported about 20 positives in a couple of schools, and the contact tracing and isolation is currently ongoing. We only have one person in Greater Accra who is currently undergoing treatment. When it comes to I think the protocols are very important, and we know that until the vaccines come, our face mask is a vaccine. When we had the last spike, when the face mask use went up, the positives also started coming down. Currently, we just done one on the 29th, although we did assess in the mandatory wearing of masks in the Greater Accra region, which is made a key center in Ghana. 6 target districts currently hotspot are Ayawaso, Korle Klote, were the areas we went to. We visited 43 communities in Accra, lorry parks, bus stop, busy street intersections, overhead, under traffic lights. This is where we have a larger number of people in public and want to see what is adherence to protocols. The data collected on the 29th of January between 7 a.m. and 10 a.m., which is where there's a peak movement of people. We're also going to do some in the morning and the afternoon in the subsequent ones. So the good news is that about 42% of our people are now wearing masks appropriately. 36% were not wearing it at all, with about 22% wearing it, 22 not wearing masks at all, and 36 were not wearing correctly. So if I add both, we are looking at about almost 80% have the intention to wear. I mean, those who are wearing it improperly is still an intention to wear, and having the mask is a good sign. So we are seeing an upsurge in the use of the mask, and we hope it will continue and hit 80% appropriate use, and look at that. But when you look at the Ayawaso West, you can see that 57% are wearing appropriately. Korle Klote, 56%. Accra Metro is still low, 39%. Ayawaso East, 39%. Ablekuma Central, 31%. And the Ghana West is 29% wearing of masks. And you can look at the not wearing and then not wearing appropriately. So we looked at the community and location with proportion of persons observed who were correctly wearing masks. You can see that the largest number was University of Ghana and Oponglo area, and the lowest number is around some of the lorry parks around the country in Accra. Baleshi, etc., had relatively lower use of them if you look at them in those communities. And then you also look at the absolute numbers of people who are actually not wearing the mask properly, not wearing the mask at all. You can see that some of the mini markets, Nima markets, etc., are probably showing the highest number of 70,000, a large number not wearing the mask, about 73% not wearing the mask at all. These are the first one were the averages, but we are now going to specific areas to show you that there are certain locations where not wearing the mask is good. If you go to the GCB Towers area, where not wearing the mask is good. If you go to the GCB Towers area, you can see that the number not wearing is lower compared to the other areas. So if you look at the trends, we have moved off from I'm looking at survey 3 all the way to survey 8. We have moved from 18% not wearing masks, and we peaked at 72% in the survey 7, but that number has dropped to 36% now. If you look at those who are wearing masks appropriately, it was high as 44 before, and then it declined all the way to 10 to even at one stage 7%, but now it has moved to 42% again. So we are hoping, because of the scale, the two numbers have switched, but the 42 is for the green and 36 is for the red one. So that is so down the mask use. You can see we hope that to continue going up, and that will be a very good way of containing this thing. So in conclusion, compared to October 2020, the number of people wearing their face mask correctly have increased from 10 to 42%, and those not wearing the mask correctly have decreased from 72% to 36%. 78% of the people observed have intention to use the mask, and 20% of the people observed were not wearing the mask at all. And I think this is an important thing that we'll continue doing every third day to see how we move on. The proportion of people who were correctly wearing the face mask slightly higher among males than the females, and the proportion of people who were correctly wearing the face mask slightly higher among children than for adults. Ayawaso West District registered the highest proportion of people who are wearing the face mask correctly